This is a schematic diagram where this part is our brainstem having the midbrain, pons and medulla. This is our jugular foramen, this one foramen magnum. Now here is the diagram of the face, hard palate, soft palate, tongue. We are having epiglottis, the hyoid bone, thyroid membrane, thyroid cartilage, cricoid cartilage, and this muscle is our cricothyroid muscle. Beneath the cricoid cartilage, these are the tracheal rings and trachea is continued. Behind the trachea, we are having our pharynx, and over the trachea, we can see our thyroid gland. Now, at the level of upper border of the thyroid lamina, we are having bifurcation of common carotid artery. It is producing the external carotid artery which is passing medially and the internal carotid artery which is passing laterally. This is our carotid sheath. Laterally we are having internal jugular vein. At the location of the bifurcation we are having aortic body or carotid body, and beneath it we are having the subclavian artery. Now if I put the vagus nerve fibers. The first fiber of the vagus nerve, that is the brachiomotor nucleus. Say in the medulla we are having brachiomotor nucleus. This is spatial visceral motor nucleus. This brachiomotor nucleus, this fiber will supply the muscle developed from fourth arch. So let us trace the fiber. So let us trace the fiber. We are having, it is going to supply the cricothyroid muscle. This is our brachiomotor fiber. Next one is the fiber that carries the taste sensation. Taste sensation from the wall of the pharynx. Here we are having the pharyngeal plexus. The fiber, sensory fiber, it is going up. It will pass beneath the external carotid and above the internal carotid. Here it is having its cell body because it is a sensory nucleus, and the fiber will ultimately relate to the nucleus tractus solitarius. This nucleus tractus solitarius, this is special visceral sensory fiber. Special visceral sensory fibers. Here we are having the spinal nucleus of trigeminal. Throughout the entire length of medulla, we are having the spinal nucleus of trigeminal. Spinal nucleus of trigeminal nerve. The spinal nucleus of trigeminal, it would be receiving the sensation from the head neck structures. So sensation carrying from the inside the larynx. This fiber comes out piercing the thyroid membrane and joins the vagus nerve. Here it is having its cell body. And ultimately entering in the medulla, these fibers terminates to the spinal nucleus of trigeminal. This is general somatic sensory fiber. General somatic sensory fiber. Beneath the vocal cord, this sensation also carried by a nerve That nerve passes between the trachea and the esophagus. It hooks like this and ascends. Here is the cell body, and following it, this fiber also joins to the spinal nucleus of trigeminal. Not only that, sensation from the epiglottis region, this part is also carried. This is a general sensation. It is also carried by this fiber, and in similar fashion, this fiber also joins to spinal nucleus of trigeminal. This brown color fiber, they actually carries the general sense from the entire larynx as well as from the pharynx. It carries general sense from the larynx and as well as carries the general sense from the pharynx. Now, in the medulla, this vagus nerve has a nucleus which is partially motor nucleus and partially sensory nucleus. This nucleus is known as dorsal nucleus of vagus. This dorsal nucleus of vagus, it is partially motor and partially sensory. The motor fibers, they are parasympathetic fiber. The motor fiber, they are parasympathetic fiber. The motor fiber, they are parasympathetic fiber. So this parasympathetic fiber descends, and it descends here, and ultimately it comes to the trachea, this thorax and the abdomen. It goes to supply the heart, lungs of thoracic viscera, and it also goes to the abdomen to supply the entire GI tract till our proximal 2/3 of the transverse colon. This is our parasympathetic fiber. This is parasympathetic fiber of vagus. From the carotid body or aortic body, the chemoreceptor sensation or baroreceptor sensation, this fiber joins the vagus nerve, ascends up. Here lies its cell body, and this fiber goes to the sensory portion of the dorsal nucleus of vagus. Goes to the sensory portion of the dorsal nucleus of vagus. So dorsal nucleus of vagus has a motor part and it has a sensory part. The motor part is our parasympathetic, that is general visceral motor part, and this is the sensation what it is receiving from the carotid body. This is general visceral sensory part. Side by the vagus, we are having our 11th cranial nerve. 11th cranial nerve, say this is a nucleus of the 11th cranial nerve, often known as nucleus ambiguous. This is a branchiomotor nucleus of the 11th cranial nerve. From this branchiomotor nucleus of the 11th cranial nerve, the cranial accessory fiber comes. And we know the spinal accessory fiber, they ascend to the foramen magnum. These two fibers, they joins in the jugular foramen and ultimately makes the accessory nerve. So we get the accessory nerve in the jugular foramen. Just after the jugular foramen, the spinal accessory fiber comes to the posterior triangle. Cranial accessory fiber joins the vagus. Now it descends down along with the vagus. First branch, it goes to supply the pharynx. soft palate. So all muscles of soft palate, it is supplied by the cranial accessory nerve except one. And we also know all muscle of pharynx is supplied by the cranial accessory fiber except one. The rest of the cranial accessory fiber, it comes down and it lives by this hookward course. It passes between the trachea and esophagus and then enter in the larynx to have the motor supply to the larynx. So cranial accessory fiber, in turn, it supplies all muscles of soft palate except one, tensor veli palatini. It supplies all muscles of the pharynx except one, that is stylopharyngeus, and it supplies all muscles of larynx except one, that is cricothyroid. So ultimately what we get from the main trunk of the vagus nerve, so what we get, this is our vagus nerve trunk. It has a nucleus, it has a ganglia definitely, and this is our vagus nerve trunk. This is our main vagus nerve which is coming downward. From the vagus nerve we get the first branch, that is the pharyngeal branch of the vagus. Pharyngeal branch of the vagus, we get this fiber passes above internal carotid but below the external carotid. It carries three types of fiber. One is a special sensory fiber going to the NTS. It carries general sensory fiber and it carries the branchomotor fiber of the 11th cranial nerve. Next branch comes, that is our superior laryngeal nerve. See, this is our superior laryngeal nerve, and superior laryngeal nerve, it passes between the internal carotid, below the internal carotid and below the external carotid. The superior laryngeal nerve gets two branches. One is a internal laryngeal, entirely sensory. One is external laryngeal, entirely motor. It also receives the tweak from the aortic body, and below, just leaving the neck part, vagus nerve, it gives a recurrent laryngeal branch. This is our recurrent laryngeal fiber. And we can see the recurrent laryngeal fiber, it passes between the trachea and esophagus and ultimately supplies the larynx. This fiber also carries two types. One is a motor, one is a sensory, one is a motor. The sensory fiber, it carries general sensation from the larynx and it relates to the dorsal nucleus of vagus. But the sensory fiber, it is actually carrying the fiber of the 11th cranial nerve. So this is our recurrent laryngeal nerve. Recurrent laryngeal nerve, it is also mixed nerve. So recurrent laryngeal nerve is a mixed nerve. Superior laryngeal nerve is a mixed nerve. Whereas superior laryngeal nerve has a motor component and sensory component. Both the components belongs to vagus. Even pharyngeal branch of the vagus, this is also a mixed nerve. It has sensory component, two sensory components. One is a special sensory, one is a general sensory. Special sensory fibers carries taste, general sensory fiber carries the general sense. And the motor fiber belongs to the 11th cranial nerve actually. So branches of vagus nerve, in the neck, if we see, it has first branch which is known as the pharyngeal branch of vagus. We can find the pharyngeal branch of vagus. The artery passes above internal carotid but below external carotid. To superior laryngeal nerve, who passes below the internal carotid, below the external carotid. And third one is our recurrent laryngeal nerve. Fibers of the vagus nerve, one fiber is the vagus nerve's own branchiomotor fiber, directly goes to cricothyroid. One sensory fiber which is receiving taste sensation from this region, tongue base, epiglottis and this part of pharynx, receives to the nucleus tractus solitarius. It has a parasympathetic motor component who gives supply to all the parasympathetic distribution in the thorax, parasympathetic distribution in the gut till the proximal 2/3 of the transverse colon, and